there are a lot of questions, especially around this first topic, this what we call MLR for short, a lot of acronyms, of course, which is minimum loss ratio. So a lot of questions because this is going into effect next year, 2011. So, you know, with CC, our fictitious client company, you know, are they impacted by this? You know, what's the formula? What does it really mean? And then what does it mean for CC? What does it mean for the insurance companies? And maybe even just as an industry as a whole. I think in the next month or so, there'll be a lot more attention coming around this particular topic as we get close to 2011. So really, what is this minimum loss ratio? Dan, I think, started off talking about if you're insured or self-insured, and I'm sure everybody in this room knows what you are. If you don't, certainly ask the question again. But really, it impacts if you're on an insured basis for your health plan. And that's where the insurance company is retaining the risk of the program. And how do you know if that's the case? Well, you know, if you're subject to maybe state insurance department requirements, you have contracts and certificates of coverage rather than maybe like SPDs. And then finally, on a funding mechanism standpoint, if you're fully insured, retention accounting, minimum premium, those are kind of terms that, again, if it's applicable to you, then you're probably going to be applicable to the MLR. And here, really, enrollment size doesn't matter if you're subject to the law. We'll get to the formula that does vary a little bit on your size. But if you're 2 or 20,000 employees, it doesn't matter. This is applied. Back to Dan and even Brian, am I grandfather, not grandfather? Does that make a difference? It doesn't with the MLR. It applies to both. And it starts next year. So for CC, yes, they are most certainly impacted. So who is not impacted then? So for those of you in the room today, if you're on a self-insured basis, technically you're not impacted. If you're self-insured, if you have a good year, that means your claims probably were better than what were forecast. And what does that mean is, well, you don't pay that out, or maybe you retain that surplus, if you want to call it. Well, since you're self-insured, you'd pay yourself back. So if it really wouldn't be applicable. Some confusion out there about that. You do buy reinsurance, so you might say, well, that's an insurance plan, but really that's not, again, subject to the MLR. The next bullet, this is really interesting because last 2 weeks there have been some articles, Wall Street Journal, about mini medical or limited benefit plans, and some of you might offer these. Typically, a mini medical is a capped benefit, maybe for $10,000 for hospital care, and maybe covers generic drugs only. Been very popular in maybe the restaurant industry or other industries where workers are at a wage level that maybe have a hard time affording major medical coverage. The premiums are high, so these are mini medical limited benefit plans. They may or may not be impacted. That hasn't been decided yet, because if you've heard about this, McDonald's a week or so ago was threatening to drop coverage for 30,000 employees. Anybody recall seeing that? I had a few calls about that. Well, that's because this type of medical benefit was being offered, and if it was going to be subject to this MLR next year, a lot of the employers may say, forget it, not gonna do it. And some of the insurance companies that offer these plans may say, boy, we may not even be able to offer them anyway. So they're looking for some exemption on that. Unfortunately, if you're an employer offering a major medical plan, you cannot be exempt. I had a client ask me that question, could I get an exemption? Well, we wish we could from PAPICA, but that would not be the case. Your flexible spending accounts are not applicable. And then finally, if you have standalone non-medical programs like the dental and the vision, again, would not be subject to the MLR. So, what is it? You're going to see two percentages, 85% if you're a large group, which right now there's still a lot of guidance yet to be released. If you're 50 or more, that's going to be probably the general guideline. There's been some discussion of 100 or more, probably be 50, and then if you're below 50, then 80%. So, and I'll define that here in a little bit. The National Association of Insurance Commissioners, NAIC, right now is developing uniform definitions and the standard definitions for the MLR. That's each state. It was the insurance commissioner from Iowa was one of the key individuals working on this, and that gets back to like those mini medical or exemptions. They've made some recommendations to Health and Human Services on maybe how this should be applicable, because it can have some pretty big ramifications. So an example, and I changed my example and I forgot to change a number on here, but like CC, let's say they have $1.3 million in claims. Incurred claims is going to be the key, and they've paid $2 million in premiums. The loss ratio is 65%, so what you do is you take incurred claims divided by the premiums. That's that loss ratio that we talked about. So the target is really $1.7 million at 85%. So in your sheets, change that $200,000 to $400,000. That's the next slide. I'll explain what happens. So there's a $400,000 difference, right, between CC has $1.3 million in incurred claims. Incurred means what was paid during the year, and then the reserve, like there's always a lag out there of claims that have been incurred but not yet paid by the insurance company. But I'll make a footnote here. What's hard, or what this NAIC is recommending, is what counts as a claim, the 85%, and what counts as an expense. Because what the federal government said is we want to use 85 cents of every dollar, or 80 cents, depending on your size, for claims. And then the rest can be used for expenses, whatever the insurance company has. Well, if you think about your wellness programs, if you have disease management, case management, is that an expense or is that a claim? It's a that can make a huge difference in this calculation, because the fear is, well, if they count that as an administrative expense, some insurance companies or plans may say, well, let's get rid of that, because I only have 15% that I can use to pay our lights and salaries and all this stuff, so maybe we start foregoing wellness and disease management. Well, that's kind of going backwards, potentially, of what we're trying to accomplish here. And then some other expenses may not be part of the calculation. Premium taxes, that if you're insured, each state, depending if you're Iowa, Nebraska, wherever, you pay a tax on premiums. And then even commissions, cost of distribution. If you're using a broker like SilverStone Group or someone else, we're not sure yet if those expenses will fall under that as well. So in our example of CC, so remember we said, wow, what's this really mean for you then? So there's a $400,000 differential between, the minimum and maybe how my plan actually performed. XYZ insurance company, do they just cut a check back? And the answer is no. It's not a case-by-case formula. What XYZ insurance company will do is they'll look at their whole block of business. So they'll take you and the 1,000 other employers that are insured and fall in that range, and they'll calculate a total loss ratio across the whole block. So if you're Blue Cross Blue Shield, that would be probably just Nebraska employers. If you're United Healthcare, that might be across Nebraska, Iowa, maybe some region, probably not national, but you can see there's going to be different pools that these different carriers will use and how they calculate the overall loss ratio. So it will not be a case-by-case calculation. But how it will work is if the loss ratios in the end are below these percentages, then XYZ or whoever, Blue Cross, United Healthcare, Coventry, name it, will issue if it's a refund, a rebate, a dividend, I don't know what we'll end up calling it, but they'll kind of give cash back, cut you a check back if they exceed that loss ratio or perform better. Meaning, again, if it's below the 85%, everyone will get a little bit of money back. That's the intent, because the government wanted to dictate, how much is used for expenses and again, not garner excessive profits. But what about if they're worse than that? We always talk about the best case scenario, everybody gets a little money back. Well, if they're above that, expenses, healthcare, claims exceeded, then they have to absorb the loss. They can't go back to you and say, give me a specific check. Now, of course, they're going to raise premiums, but we also know with healthcare reform, PAPICA, there's a lot of scrutiny now on insurance increases. I think you'll again start to see that. We saw a little bit of it here earlier this year, last year, when other states, Iowa as well, were more on individual insurance, but the premium increases were 30, 40, 50%. The hammer kind of fell down, saying, well, we've got to really justify that. Well, again, if their losses are above that and they raise premiums, then there'll be some other scrutiny. So there's only if you think from the insurance company side, there's a positive impact for employers, but nothing that they can do about it if expenses are worse than expected or that mandate. So if you think about from an industry perspective, what does that really do? Well, and this is straight out of the NAIC. If you go out, I talked about that they're making this recommendation to Health and Human Services. I really pulled this first bullet from their letter to Secretary Sebelius. The MLR has the potential to destabilize the marketplace and limit consumer choices. A couple examples, if some of you probably are aware, and maybe you're even impacted, but an insurance company located in Des Moines, Principal, has just recently decided to exit the health insurance business. Now, they didn't come out and say we don't like healthcare reform, but I've been around long enough to know that it had a significant impact, and really on this minimum loss ratio. Depending on their block and how they're performing and their discounts, all the stuff they probably decided that's probably one aspect that we just can't afford, because if on the downside we have to absorb the loss. And then we're also seeing a lot of insurance companies exiting maybe even certain lines. Like many states now are getting out of the child-only policy. Like individual insurance, you're all group plans, but they can issue insurance policies to children, say they're under age 19. Well, if there's no more pre-X for children, there's now loss ratio requirements. Pretty much child-only policies are being pulled from the market in most states because, again, the ability to handle risk is difficult. Oops, I think. Okay. Moving on to the early ERRP, another acronym, Early Retiree Reinsurance. I'll spend just quick couple of minutes because I know this isn't applicable to you, and Dan mentioned a few things regarding this, but I just want to, first thing I want to say is if you happen to offer health insurance on your plan, and this is insured or self-insured, grandfathered, non-grandfathered, doesn't matter, but if you do offer coverage to retirees 55 to 64, there could be some money in it for you. And those of you I know in this room have already participated in this. It's not really free money, but there's an incentive to continue providing coverage to these retirees before these exchanges come around in 2014. So in our example, remember we mentioned that there are 30 early retirees that are still under their health plan, they're insured, and they can have it up until they're eligible for Medicare. If they continue to provide this to the retirees through 2013, they can receive what's called a subsidy or reinsurance payment from the federal government for claims paid on just those retirees, as well as if they're married spouse and if they have kids. So what the government's trying to do here is say, just don't drop your retiree health plan. Dan mentioned maybe you carve it out and make it separate, but the government's trying to say we don't want you just to drop this right away in anticipation of what's coming up. So starting this year, CC would be eligible for a reinsurance payment for 80% of claims paid by the plan, like I said, if you're insured or self-insured, for these individuals that have claims between $15,000 and $90,000 per year. So what has to happen is the year's over, the insurance company would provide a report for 2010, how much in claims these retirees' their spouses and kids have. Now this year is a transition year, I won't get into it, so there's not really a full reimbursement this year, but starting in 2011, there's a full dollar amount. So if you think a lot of groups, you hear a lot about maybe City of Omaha or other groups that offer retiree coverage, this could be a lot of money, a substantial amount of money. That's if you think 80% between 15,000 and 90,000. What they have to show, though, is that they must achieve cost savings for retirees that have chronic and high-cost conditions. So there's an application process, and you have to kind of talk about what you're doing to manage costs. And then CC has to apply for it and then document claims. I think we're just... There we go. So you get some money back on what can CC spend it on. This hopefully everybody will get this correct. But can they buy a company car, use it for the Christmas party, executive bonuses, or health plan costs? The answer is obvious. The last one, you have to use that money specifically to cover your back into the health plan. So even though it's a payment, it's to help subsidize. Now it can be spread across everything, not just the retirees. You could use it for your actives and paying for expenses overall in the health plan, but there are some, of course, limitations on what the money can be used for. So there's an application process. If you haven't applied today, maybe even if, I mean, I have a client that has one early retiree, and we went ahead and applied. I mean, why not? It takes, you know, half an hour. We can assist. You know, fill out the paperwork. You mail it in. And so there's a website that it's an electronic PDF form. Unfortunately, you can't save it. They've made it kind of a little bit of a pain, but you just fill it in, and then we mail it in, and then you work with the carrier and getting some data to help complete the application. But certainly, if you haven't yet, let's get it filled out and sent in, just so you don't miss the boat on some money. So what about the money? You know, is this an unlimited pool? It is not. The government set aside $5 billion with a B, which sounds like a lot of money, and that's supposed to go through 2013. But if you think about companies, maybe a General Motors or, you know, these really humongous companies that have retiree insurance plans, probably right now not forecast to go past 2011, unless more allocation is provided. So that's just actual estimates. And for 2010, the payment will be made in next year once the actual claim data is submitted. And we certainly encourage, again, to get that application in today if you're eligible.